So prior to entering the patient's room, I check the physician's order. I make sure that they're in need of a dressing change. And in this case, I'm going to be doing a wet to moist dressing change. And I also check for any allergies, make sure that they're not allergic to latex, because if they are, that would affect the type of tape and gloves I'd use. So I perform hand hygiene. I'd enter the supply closet and I'd gather my supplies. So I'd get a gauze kit that has gauze and some saline. I'd get 2 packs of Q-tips. I'd get an alcohol pad, a pair of sterile gloves, tape, and a pen. So I can go ahead and now gather my supplies, walk to the patient's room. I can knock. Hello. I provide privacy by closing the curtain or door. I can perform hand hygiene on both my hands. These would be in my pocket. Then I can go to the patient, introduce myself. So my name's David. I'm going to be your student nurse today. Can I get your name and date of birth, please? All right, Mr. Smith. So then I verify that with his wristband. Okay, so I verify the patient's identity. So I'm just gonna be doing a dressing change on your abdomen. All right. So before I begin with that, are you having any pain at the moment on the scale of 0 to 10? 0? Okay, sounds good. So the patient's not in pain. I explain the procedure and I verify his identity, so I can go ahead and begin setting up. So I go ahead and raise the bed to a comfortable working height. I can move the trash can close by my working space. Then I can perform hand hygiene once again. And then I get all my supplies out of my pockets and I could put them on another area. And then I could clean my sterile area. So first, I would get a pair of clean gloves. And then I would, in the hospital setting, the table would be raised much higher, but this is what we're working with. So I can go ahead and wipe my area a certain way, making sure not to backtrack over anything. Then I could do the corners just once. Then I could toss the wipe and my gloves. And now I can go ahead and set up my field. So I could take all the supplies out of my pocket. So I can go ahead and put this here. Put my saline right here. Also, I'm observing the packaging of all my materials, making sure that they're not damaged or compromised. So my gloves that I'm using. My dry gauze pack. I have my 2 pairs of Q-tips. And then I have some tape. So I'm just going to use the tape to tape them up against the edge of the table. Go ahead and do that. And I can do that with the other one as well. All right. So after doing that, I can go ahead and perform hand hygiene once again. I'm not on my sterile field. This is my sterile field. This is not. So I'm performing hand hygiene. You get my second pair of clean gloves. Put them on. And then I have my alcohol pad that I'm going to be using right now. So I'm going to go ahead and I already raised the bed. I can go ahead and lower the patient's gown, being mindful of their privacy. And then I can go ahead and open my alcohol pad, toss the packaging in the trash, just drop it. So then I can, while also keeping an eye on my sterile field, I can go ahead and begin using it to loosen up the tape, pulling towards the center. Right. And then I can quickly draw it away from the patient, as not all patients want to see this. So I'm assessing the coca of the material, so the color of any blood, any signs of infection, any odor, the consistency as well, and any amounts of, I'm also looking for drainage as well. So then I can go ahead and get one of my Q-tips, and I can use it to take out the old packaging materials, not hovering above the sterile field. All right, and I'm also assessing the packing materials for color, odor, consistency, and any amounts of drainage, etc. So then I can go ahead and measure. I'm gonna crumple that up a little bit. I'm gonna measure the depth of the wound, and then I can measure it up against my dry gauze ruler. So I see that that's about 2 centimeters deep. I can then measure the length. Okay, and I can see that that is about 10.5 centimeters long. And then I'm gonna measure at the widest part to measure the width. Perfect. So I can see that that is about 6 centimeters. So now I can go ahead and crumple everything up in my gloves and dispose of it. We'll also not turn my back on the wound or the field. So then perform hand hygiene again. And I can begin setting up my area. So first, I'm gonna have to get the proper amount of tape. So go ahead and set that on the side. And once a reminder that this would be much higher in the hospital, it would not be going lower than my waist or even near my waist at all. All right, and then on one of the tapes, I would go ahead and put my name, date, and initials. So put DM 11. And then the date is 11/4. So go ahead and put that back down. All right. So now I can put that back. And for safety, I'm going to go ahead and do this one more time. And then I'm going to open my dry gauze. Going to make sure that I open it firmly so that way this does not keep falling back over the gauze. Then I'm going to loosen the cap on my saline. And then because this is a used bottle, I can go ahead and lip it. Then put the cap on. Next, I can go ahead and open up my gauze kit. Okay, go ahead and put that on the side. And finally, I can go ahead and begin with my pair of gloves. So I'm just gonna, once again, I already inspected the integrity of everything. Nothing's open. So now I can go ahead and open my gloves. Dispose of that. So they appear to be very fine, not damaged at all. So I have to be mindful and be sure to only touch my 1-inch borders. I do not want to allow them to touch the gloves. I don't want to transfer any germs from them onto my sterile field, which is the middle. Can't hover over that either. Not hovering over the gauze either. All right, so first I'm gonna go ahead and pinch this, gonna lift it, move back, and then I'm going to put on this glove. Keeping it above my waist at all times. If it goes below, that breaks sterility. All right, so with that one glove on, I can go ahead and remove the cap off this saline, and I can go ahead and use it to soak my packing materials. I can put the cap back on. Next, I can go ahead and insert this hand under the cuff of this glove, can lift it, move back, and then I will insert my dominant hand into this glove as well. A bit tricky to put on. I just want to be mindful to not put it below my waist and break sterility, and also not touch my skin with my left hand, which I administered the glove on earlier. All right, so my gloves are on and my packaging material has been soaking, so I can go ahead and use it. So I'm gonna go ahead and get this one piece, not hovering over with my body as well. You can go ahead and wring that out. If you got any excess, you can put that down. And I'm gonna work with the rest of my gauze as well. All right, so now I can get my second Q-tip from the other packaging. Never want to use two Q-tips from the same packaging. And I can go ahead and begin inserting the packing materials. So I do not want to hover over the field, and I also want to keep an eye on it. I do not want to completely turn my back on my gauze, on the packing materials or my dry gauze, as that would compromise their sterility. All right. Okay, my last piece. Okay, so now I can just drop this in the trash. You can go ahead and place my gauze on. I have broken sterility. So now I can get my 4 pieces of tape and begin placing down the dressing. And once again, reminder that this would be much higher, way above my waist. All right, and also as I was taking out the packing materials, removing the old dressing, and applying the new ones, I was also assessing the patient for any pain. So if the patient was in pain, I would have stopped and slowed down, maybe done it later, and I would also document that. So then I can go ahead and cover him back up. I could lower the bed, and I can ask, is there anything else you need from me at the moment, sir? No, Mr. Smith? All right, so the call light is right there. If you need it, just press it, someone will come help you, okay? So then I can go ahead and dispose of all my trash. I'm gonna take this off. Then I could remove my gloves. I can go ahead and clean the table after that. I can go ahead and pack my kit up, take that with me. I would go ahead and perform hand hygiene once again. And then I would provide privacy and exit the room and document accordingly.